I will be talking about the hepatitis A vaccine. So hepatitis A is a liver disease that is spread through close personal contact with someone who's infected, or you can actually get it by ingesting the virus from objects or food products that have been contaminated. So some signs and symptoms are fatigue, low appetite, stomach pain, nausea, and jaundice. And it's important to remember that this is a liver disease, so you most likely will see jaundice. So it's important to check the patient's skin, their eyes, every so often. And then people who have Hep A and do not have any signs or symptoms can still infect people. So it's just like COVID, where even if you don't have the COVID symptoms, you can still give someone else COVID. All right, and a little bit about this vaccine is that it's an inactivated vaccine, meaning it contains the whole dead virus. Other vaccines may contain partial live virus or like full live, but this one doesn't have any of that, so there's no risk of making you sick right away, like some people would think. And this is given intramuscular, which is usually for the deltoid right here, or in young children in the thigh. And this was first licensed in 1995 in the US. It was actually licensed years before that, I believe in 1991 in Europe. And it has provided since long-term protection, shown to last about 10 years. And with this vaccine, hepatitis A has been made less likely to occur in the US. As far as dosing, children should receive 2 doses of the vaccine. So the first dose should be given around 1 year, so like 12 to 23 months, and the second dose at least 6 months after the first. And pregnant or breastfeeding people can still get the vaccine, despite other vaccines where you cannot give them. And people who are moderately to severely ill should wait to recover to get the vaccine to avoid any complications. And it's actually recommended for people who are international travelers, homeless, people who have HIV or at risk for HIV, people with chronic liver disease, and men who have sexual contact with other men to get the vaccine, especially if they hadn't had it as a child before, as they're more susceptible to contracting hepatitis A. And if someone were to have direct contact with someone who has hepatitis A, they should receive the vaccination as soon as possible and within at least 2 weeks of exposure to limit the risk of contracting it. So after receiving this vaccine, you should always monitor for an allergic reaction. Tell the patient the signs and symptoms of an allergic reaction, which may be shortness of breath, a fever, a rash, and alert them that the site may be sore and red for a little bit. Moving your arm could hurt, but that's common with any kind of vaccination. And please always notify the patient that if they experience respiratory distress, like severe shortness of breath, a high heart rate, some dizziness, weakness, that they should call 911 right away, as this may be a very serious reaction to this vaccine. Related to that, if you know you have a reaction to the hepatitis A vaccine, you should notify your provider, and they will most likely not give you the second one or figure out an alternative.